The Mount Sinai Advanced Resuscitation Initiative, or ARI, is a quality improvement project that aims to improve outcomes of patients with out-of-hospital cardiac arrest in the emergency department. According to registry data, there is a significant variability in survival from cardiac arrest rates, both across and within pre-hospital and in-hospital settings. Survival differences as much as 3% and 16% for pre-hospital and 2 to 12% survival to hospital discharge have been reported. Furthermore, patient survival has been linked to quality of cardiopulmonary resuscitation, and specific performance metrics have been identified as predictors of favorable outcomes. Chest compression fraction, depth, and rate of compressions, chest recoil, and ventilation rate had all been specified in the latest resuscitation guidelines, reinforcing the importance of high-quality CPR as the key intervention to improve survival with good neurological outcomes. In 2013, with the goal to close the gap between the existing evidence regarding optimal resuscitation care and its translation into clinical practice, the American Heart Association published a consensus statement which was endorsed by the American College of Emergency Physicians, where they called for a transformative change, providing specific recommendations for providers and healthcare systems. This includes the incorporation of 4 types of interventions: the use of metrics of CPR performance by teams to enhance resuscitation quality, the incorporation of monitoring and feedback parameters to guide patients' response to resuscitation and team's performance, team-level logistics to ensure high-quality CPR in the complex clinical setting of resuscitation, and systematic clinical quality improvement to identify specific areas of deficits, design, and implement improvements. The ultimate goal of the Advanced Resuscitation Initiative is to improve cardiac arrest outcomes. The Advanced Resuscitation Initiative has been assembled as a multidisciplinary program that includes faculty from the Division of Emergency Critical Care, faculty from the Simulation and Division of Quality in the Emergency Department, the Clinical Nurse Manager, Director of Nursing, Senior Nurse Educator Champion, Senior Emergency Medicine Physician Assistant, representative of the Respiratory Therapist Team, Cardiology Fellow, in addition to a Neurovascular PA. The program entails 3 phases: assessment, intervention, and reassessment. The assessment phase in this initiative entails 2 sources of data to evaluate the quality of our resuscitations. The first is the use of a standardized cardiac arrest QA survey that will be linked in EPIC within the cardiac arrest note, which will be rolled out hospital-wide and should be used for documentation of all cardiac arrest at Mount Sinai. This brief survey covers various indicators of CPR quality and team performance. This survey should be completed by the resident or attending leading the resuscitation, ideally within the next hour after finishing the resuscitation. But aware of the limitations of provider-reported data regarding quality, we also want to obtain objective, quantitative data from cardiac arrest resuscitations using a monitor defibrillator with capability to record initial rhythm, defibrillations, chest compression fraction, chest compression rates, and length of CPR interruptions. For this purpose, a LifePack 15 defibrillator monitor and a CodeStat data reviewer software had been loaned to our department by PhysioControl. This device has been placed in the resuscitation area on a dedicated cart, as you can see in this picture. We expect the clinical team to preferentially use this monitor in all cardiac arrest cases. The data recorded from this monitor is then downloaded by our team into a laptop with CodeStat software that allows analysis and the generation of a summary report containing details of the performance of each resuscitation. This data, along with the provider-reported data, will be reviewed by the QA group in a monthly CQA process. Feedback will be given to providers. We believe the Advanced Resuscitation Initiative program has the potential to improve survival of patients with out-of-hospital cardiac arrest and enhance the team's performance during resuscitations.